guys, welcome back. I wanted to make another video explaining the process of getting approved for surgery and also giving some information on the surgery I'll be getting and the nerves that I'll be getting decompressed. So to start with the process of it all, the first step was finding a surgeon, obviously. And I first had an appointment with Dr. Lowenstein in California. He's kind of the migraine surgeon guy. He pops up first when you research it. He does a lot of cool marketing for the surgery, and he also does a lot of podcast interviews and videos. I'll link some of his resources below. He has a lot of really helpful information. So we scheduled a virtual consult with him first, and he really encouraged us to go see Dr. Janis at Ohio State, who's a lot closer to my area. I would have been willing to travel for the surgery, but I think getting on a plane right after surgery would be really horrible, and obviously it'd be way more expensive to have to travel. So I was really glad that there's a reputable surgeon in my area. So Dr. Janis was one of the original migraine surgeons. He actually did a lot of the foundational research for the surgery. It was discovered by a plastic surgeon in Cleveland who did brow lifts on people, and it removed their migraines because the nerves around the muscles in your forehead can compress the nerves and cause migraines. So it's kind of an accidental discovery, and Dr. Gyron, who's the original guy, worked with Dr. Janis to do a lot of research and figure out what other peripheral nerves can be operated on. And so they're the ones that discovered it's not just the forehead, it's also the temples, it's the occipital nerve in the back. And so going into my appointment with Dr. Janis, I had listened to a lot of his podcasts and seen his website. And so I really trusted that he knew what he was doing because he did a lot of the original research. So I had an appointment with Janis, I think about 2 weeks after I contacted his office. He tries to have an appointment with someone for migraine surgery within 2 weeks, as long as they are referred by a neurologist. He works really closely with neurologists and wants to make sure that his patients have seen other doctors and tried other treatments first. Obviously, you don't want to just jump into migraine surgery. It's sort of a last-ditch effort. And so he works closely with the neurologist at Ohio State, which I really appreciate. And I think that that's such a positive about him, is that he doesn't just take anyone and cut them open. He actually is really intentional about what patients he sees. And so the process for me of getting approved took a lot longer than expected, and it wasn't his fault. It was just happened to be that I had gotten Botox for my migraines a couple of months before I went to see him. And the process of getting approved involves nerve blocks, and also sometimes he uses diagnostic Botox. And you can't obviously get more Botox when you already have Botox in your head. So for me, I had to wait 5 weeks to see him again to get the ball rolling. And that was really, really discouraging because I had expected that first appointment with him to kind of answer my question of whether or not I was a candidate. And so I had to wait 5 more weeks. And the other thing that was really difficult about that period is that I wasn't able to take any new treatments or any new drugs or anything because my pain had to be baseline before he did the diagnostic testing, which obviously makes sense, and I trusted the process, but it was really hard to go those 5 weeks with no medication and also not even knowing if I was a candidate yet. So that was really tough mentally and involved a lot of waiting, obviously. Which was really, really hard. 5 weeks felt like the end of the world, which if you ever had a migraine, you know that each day is like the end of the world. So it was really hard. But I went back to him 5 weeks later. My Botox had completely worn off at this point, and so he was able to establish my baseline pain, and he was able to perform nerve blocks without the Botox interfering with the results. So some surgeons might do it differently, but Dr. Janis only does one nerve at a time. And so my first visit with him, we actually didn't even do nerve blocks. So first visit was the visit where he told me to wait 5 weeks. Second visit, he did something called the Doppler, which is a little ultrasound machine. It has a little probe on it, and he had me point to where my head hurts and my temples, and he put the Doppler on those areas, and he could actually hear my heartbeat in those spots, which means that there's probably blood vessel interaction. So for me, those spots were right here in my temples, and then I actually have 2 spots on my right side. I have sort of a mirror spot to here, and I also have a spot a little farther back. But he believes that Both of those are actually blood vessel interaction with the auriculotemporal nerve, which is super common because the temporal artery and branches of that artery are anatomically right next to the nerve. And so it's really common for people to have bad interactions between those. So sometimes they overlap, sometimes the blood vessels almost wrapped around the nerve, which I think that's what I have because that pain is so intense and it really does throb in time with my heartbeat. I also have a ton of ear symptoms, like I have ear pain and I have tinnitus and I have pulsatile tinnitus, which means tinnitus that thumps in time with your heartbeat. And so it makes a lot of sense that I have that interaction with the auriculotemporal nerve. It also kind of makes sense why a concert triggered that because noise exposure obviously is related to your ear. So pieces of the puzzle started to kind of come together when he found that spot that needs decompression. So that was the second appointment. I got the Doppler done. And by that point, I knew I was a candidate for surgery, at least in those spots on my temples. I didn't know about the other spots yet, but I was feeling pretty confident then because my temples are far and away my worst points of pain. And so even if I just got my temples decompressed, I think I'd be in pretty good shape. So I was feeling a lot more confident at that point. And from there, the process moved a bit more quickly. He saw me in, I think, the very next week to do the first round of nerve blocks. Like I mentioned earlier, he only does one nerve at a time. So he did the right side above my forehead first, and it did take the pain away. Nerve blocks are just shots of lidocaine. They are not meant to treat pain long term. It just shows you immediately what's going on with the nerve. So for me, the effects of it only lasted about 15 or 20 minutes. And it didn't really feel like relief because it was just right here that didn't hurt and then everything else still hurt. Some people that get the nerve blocks immediately feel complete relief if they only have one nerve that's the issue. For me, that wasn't the case, so it didn't feel great. It just was nice to know that those nerves are causing the pain in that specific area, which means that I'm a candidate for decompression in those nerves. He saw me again a week later, and he did the final nerve block in my forehead on the left side, and same thing there. It took away the pain in that small area for 20 minutes. And then he ended up seeing me a week later to do nerve blocks in the back. Now, I'm not sure if I'm going to pursue surgery in the back because my pain in the occipital nerve is not that debilitating. So I don't know if I'll pursue the surgery in the back or not, but it's good to have on record that those nerves did respond to nerve blocks, which means that I am a candidate for surgery in the occipital nerve. I just don't know if I will pursue it or not. So after all those nerve blocks and all those appointments, he saw me back one more time to discuss the plan for surgery. And that was a longer appointment. It was about an hour. And he really just talked all the details of surgery, which I was super interested in. I know some people probably don't want to know what's going on in their head. I feel like that can scare some people or stress people out. But for me, I actually find a lot of comfort in knowing the science behind it all. To me, that's super reassuring. It was actually super reassuring when I started researching the surgery before I ever met with a doctor. And I realized that my pain falls so neatly into those areas that they can decompress. I started noticing my pain was in those areas. And that really helped me actually when I have a really bad migraine in, the left side of my head. I'm like, it's just my auriculotemporal nerve. And that kind of helps me to be a little bit more scientific about it and not get so emotional about the pain. So for me, I was super interested in hearing all the details about surgery, which I guess I'll just go into that now and explain kind of what surgery I'm getting. So as I mentioned, I think in my last video, they can perform surgery either in the front of your head or in the back of your head. Based on my nerve blocks, I am a candidate for both surgeries, but like I said, I'm not sure if I'll pursue the back surgery yet. It really depends on the results of the front. He explained that sometimes people who don't complain that much about pain in a certain area feel that pain more once the other areas are taken care of. So for example, I feel so much pain right here and it's so overpowering, but maybe once that gets straightened out, I'll feel pain in the back more. But there's no guarantee that will happen. It just depends on if the first surgery is a success, if the first surgery takes away my pain, I'll see what residual pain I have and then make a decision based upon that. But I'm definitely getting surgery in the front. That is scheduled for December 7th, which is super soon. There was a cancellation, thankfully, so I'm really, really thankful about that. So I will be getting 6 nerves decompressed. There's 8 in the front total, so I'm getting all except for 2. I'm not getting the ones that are right here in your temple. It's the zygomaticotemporal nerve. Because my pain doesn't feel like it really starts right here. I feel like it starts farther back and radiates forward. And so that means my auriculotemporal nerve, and then the 2 nerves above each side of your eye are the supraorbital and the supratrochlear nerve. So I'm getting those 2 on each side, and then the auriculotemporal, so 6 total. So the incisions for the nerves above your eye, you go in actually through the eye. It's a little cut right here. It is a cosmetic incision. It's the same incision you would get if you got a brow lift. And they actually go in and just explore the entire nerve. It just runs like right up to here. So they look at the entire thing and they clear out any blood vessels that are interacting. Sometimes they have to shave down your brow bone a little bit. Some people have fascia interfering and muscle as well. I believe the surgeon said that he actually is going to just go ahead and remove a little bit of the muscle in my forehead, which would be kind of similar to a brow lift, I guess. So I'll take it. And then for the nerves in my temples, the right one is a little more complex because I have 2 spots that are trigger sites there. So what that means is I will have 2 incisions on my right side. I will have an incision right here to address the spot right there, and an incision a little higher up to address that spot. What they do with that one is they go in and they look at whatever's going on with that blood vessel, and they remove that source of compression. So like I said earlier, sometimes it's wrapped around, sometimes it's just one intersection. And sometimes they actually, if it's so mangled up, they actually do cut that nerve. All of these nerves are sensory nerves, not motor nerves, so it's not going to affect motion or the way I move my face. It would just be, I would have a little spot of numbness, which actually sounds really great. I told him, I'm like, you can cut my nerve. I would prefer the numbness. So we'll see. I won't know until after surgery, what was going on in there or how extreme it was. But I expect the right side to be pretty mangled up just based on my level of pain. On the left side, my pain is not nearly as bad, but it is still enough to get the surgery. And they will make a little incision right here that mirrors the incision over here. And same thing, they'll look at that blood vessel interaction and deal with it. So those will be where my incisions are. They do scar a little bit, but I've seen pictures of people's scars and they're nothing crazy. Like I said, this one's cosmetic, so a lot of people have that scar and it's not a huge problem. And the ones on my side of my head will be in my hairline. He did say I'll have to shave a little bit of hair for that spot farther up, but I'm not worried about that. I mean, he could shave my whole head if he wants. I don't care about that side of it. I'm just really thankful that I am a candidate and that I'll be getting it so soon. So I guess I'll explain a little bit about the surgery in the back super quickly. I'm not getting that one yet, but that one's a completely different incision. It is a lot bigger. It's about this big, and it is 3/4 of it is in your hairline, and 1/4 of it sticks out. And they cut that big incision, and then they go on either side of it to decompress your occipital nerve. Your occipital nerve is a lot bigger and thicker and longer than the nerves in the front of your head. And so that surgery requires a bigger incision because it covers a lot more surface area than the little nerves in the front. And that scar is pretty gnarly, but like I said, not sure if I'll get that one yet. If I do, I will obviously document it and talk more about that in detail later on. But I don't really know if I'm getting it, so I don't want to spend too much time on it. But yeah, that's a little bit about the story of how I got approved and the surgery that I'm getting. It is a week from today, so feeling super excited. I am not expecting recovery to be easy, but I honestly don't think it'll be too bad. I will be on a ton of medication after surgery. I don't even remember everything. I know gabapentin, which is a nerve medication. They gave me 15 oxy, just 5 milligrams. Different kinds of ibuprofen, really big, high strength ibuprofens. There's definitely more Toradol, I believe, Zofran for nausea. There's a few more pain medications. I've heard from a few people that said they didn't really need as many pain medications after surgery because their head stayed numb for a long time, which I'm kind of hoping is the case for me. I know that it can be painful once the nerves wake back up because obviously during the surgery, he's going to be messing with the nerves, moving them around, and they aren't going to like that. So sometimes the nerves kind of feel like they're burning when they wake back up. But I'm hoping the numbing stays for a while, and I'm hoping that the pain responds to the medication. So I'm not too worried about that side of things. I've already been in pain for so long, so I don't think it can be worse than what I'm experiencing now. But yeah, I'm excited that it's so soon. I don't have as much time to kind of spiral or get anxious about it since it's a week away. So yeah, that is a little bit of the story of how I got approved. I will continue to post. I probably won't post again until after the surgery. I'll try to record as much of recovery as I can. I don't know how I'll be feeling. I hope that I sleep a lot. I hope I'm really exhausted from the medication, but I will definitely try to record as much as I can and take pictures of my scarring and bruising. I know around the eye area it can cause a lot of bruising, so I'll definitely be recording and documenting all of that, and I will post it whenever I can. But thank you so much for watching. I appreciate all the support on the last video. It really means a lot, and hope you guys are doing well, and see you next time.